And last week on Friday, the World Health Organization did endorse the first malaria vaccine, and the trials for that vaccine were happening right here in Kenya on the western part of the country. With the vaccine, are we out of the woods yet, or what's going to happen? Tom tonight is speaking with Dr. Rose Jalango, who is from the National Vaccination Immunization Program. The Minister of Health, of course, we do not want to miss that conversation. Do we rely on the vaccine alone, or do we still need to use our mosquito nets and repellents? So keep tweeting at KBC Channel 1 News, at Purity_Museo, at Mboya24, and ask us a few questions. And let's look forward for that comprehensive interview. So Tom, it's over to you.
Welcome back. As we have promised you, Dr. Rose Jalango from the Ministry of Health, live in studio. She's attached to the National Vaccines and Immunization Program. Thank you so much, Dr.
Thank you for having me in the studio.
Very well. Now, we'll get straight into it. The World Health Organization has approved a vaccine against malaria that is being seen as a major milestone. And before you tell us about the impact of that breakthrough, tell us first how severe malaria is in Kenya.
I think one of the diseases that is commonly known in this country is malaria. So we do know the impact of malaria in our lives, and especially the mothers know the impact of malaria in their children. What I do know is that in the last Kenya Malaria Indicator Survey that was done in 2020 showed that we have a national prevalence of 6%, right from 8% from 2015. However, in the Lake Endemic region, we do have a prevalence of currently 20%, up from previously 27%. So the prevalence still hasn't gone down as we expected. It's sort of plateaued. Then the second thing is that malaria outpatient visits account for the second highest in the country, so especially in the endemic regions. So if you go to the outpatient clinics, you're more likely to see someone who has presented with malaria. And then lastly, malaria disease still contributes to the top 5 diseases that affect children under 5. So it contributes to a high mortality and morbidity to children who are aged less than 5 years of age. Yeah.
Kenya was amongst the 3 countries chosen for the malaria vaccine trials. I think the other one was Ghana and Malawi. Is that correct?
Yes.
So what major health impact will this vaccine have, especially to us here in Kenya?
All right, so what we did do is that between 2009 to 2014, Kenya was one of the countries that participated in the phase 3 clinical trials. There were 7 countries that were participating, and Kenya had 3 sites that participated. So that is Kilifi, Siaya, and Mboya. From 2019, Kenya did implement the malaria vaccine into the routine national immunization program. So what this means for us, for the World Health Organization to actually approve the first vaccine to be used, to be rolled out, it means that we are going to see less cases of severe malaria, less cases of hospitalization, less cases of admissions, especially for children who are under 5 years of age.
Okay. So the rollout is really, children specific. So what are the ages that we are looking at?
So the rollout is children specific. So malaria vaccine is a 4-dose schedule. The first dose is given at 6 months, the second dose at 7 months, the third dose at 9 months, and then the last dose is at 2 years. So it's being given in addition to other childhood interventions. Okay. So for example, at 6 months we give it with vitamin A, and then at 7 months we do include growth monitoring. At 9 months we also give measles rubella first dose, and then at 2 years we do give vitamin A, deworming, and also growth monitoring. Okay. So this vaccine was actually introduced in the western part of the country because that is where we do have a high to moderate transmission of malaria.
Malaria.
Yeah.
Now, obviously the caveat to this breakthrough is that adults are not eligible. So what does that mean really for them?
Adults are not eligible for this malaria vaccine because, again, we say that malaria contributes to under 5 mortality and morbidity. So what adults need to do, there are other preventive measures that have been put in place by the Ministry of Health, which includes sleeping under treated mosquito nets. So in case they suspect that they have malaria, they need to get treated. And then for the pregnant mothers, they need to, when they know that they are pregnant, they need to go to the facilities and also get started on prophylaxis treatment.
Okay.
So that applies to those pregnant women who live in the endemic regions.
Okay.
Yeah.
You say that for the older demographic, you are pushing the use of nets and that kind of thing. But when you go down to the ground, you realize that some of these nets are not being used for the intended purposes. We have people, for example, from the Lake Basin, using them for fishing. And my question then would be, is that an indictment to your awareness programs, for example, do you think?
So what we do, I know that we do have a strong awareness program in place, which is being championed by the National Malaria Control Program, to make people aware that they need to sleep under mosquito nets. So in addition to that, there are several campaigns that are actually conducted on after every 3 years. We call them mass net campaigns, which target 27 counties. And then routinely, either to pregnant mothers and also to children who are coming for vaccination, we provide them with insecticide-treated mosquito nets so that they can sleep under them. So it's a continuous advocacy that the Ministry of Health does through the National Malaria Control Program to create awareness and also change behavior when it comes to utilization.
All right, that milestone is obviously an upturn in the management of malaria. So where are the vaccination centers, for example? How will it be administered?
So we are currently rolling out the malaria vaccine. It's being rolled out in 8 counties in the western part of the country. The counties are Kisumu, Siaya, Homa Bay, Migori. Then on the western part, we do have Busia, Vihiga, Kakamega, and Bungoma. In those 8 counties, there are 26 sub-counties that are actually offering the vaccine. So we have a network of 600 health facilities in those 26 counties where the vaccines they are being offered free of charge. So we do have the private facilities, faith-based facilities, and also the FBOs, faith-based organizations that are offering the vaccine for free.
What about those far-flung areas where we find women perhaps giving birth in their homes? Are those people within your framework?
Yes.
Rollout framework? I mean, how do you get to them? The women are giving birth in their homes, they're raising the kids in their homes, but they also need this vaccine.
Yeah, so for such areas, we do have a robust health system in terms of the facilities that offer immunization services. So we do conduct outreaches from health facilities to those remote areas where the caregivers cannot access facilities to come and get the malaria vaccine. So we have that taken care of through outreaches, bringing the vaccines closer to the communities.
And you're also working with the county government?
Yes, we do. Yeah. So in terms of this rollout, we do have the national program, and then we do have the counties. We do have a shared collaboration. So whereas at the national level, we do more of policy formulation, resource mobilization, and also procurement of the vaccines, the county on the other side implement the policies, and also they oversee the service delivery of the malaria vaccine and also other interventions.
Okay. In terms of efficacy and safety levels, where would you place this vaccine?
What I do know is that we don't have an intervention that is 100% perfect or effective. Even for the other routine vaccines that we do use, none of them is 100% effective. So for the malaria vaccine, we do have the effectiveness is at 40% against clinical malaria. That's after 4 years, and at 55% at 1 year. So we look at the overall public health impact of the malaria vaccine. vaccine. So it's going to reduce the cases of severe malaria, it's going to reduce the cases of hospitalization, and also the need to do things like blood transfusions, so which put a lot of pressure on the health systems.
So, I mean, are we out of the woods yet?
We are not yet out of the woods. There is a time we did stall with the malaria interventions. So we were using the insecticide-treated mosquito nets. We were doing spraying, giving the treatment to mothers, doing the prompt diagnosis and treatment, but still the level at which we want, the rate at which we want the burden of the disease to go down was not as fast. So that is why we have an additional intervention, which is the malaria vaccine. So we were not yet out of the woods, and that's why we needed to layer another intervention, which is the malaria vaccine.
So if we are not out of the woods, then which other new mechanisms does the ministry have in place just to make sure that we are on course in terms of in the war against malaria?
So we do have the laid measures that have been set aside by the Ministry of Health. So we'd talked about the sleeping under the mosquito nets. We've talked about the indoor residue spraying. We've also talked about prompt diagnosis and treatment. We also have larviciding, which is supposed to take course in the course of this month, again targeting the 8 counties that were introducing malaria vaccine.
Okay.
Yeah.
But now, you know, the trial for the malaria vaccine, it kicked off even before the COVID, struck. And I'm wondering, why do you think it's taken so long to come up with a malaria vaccine?
Yeah, I know the malaria vaccine has been in the pipeline for the last 30 years, and it's because of the complexity of the malaria parasite. So a vaccine that a vaccine that to be developed is one that has to target the human, the life cycle of the mosquito in both the life cycle in both the mosquito and also the human, and then the malaria parasite is known to be very evasive. That's why it's taken a long time for us to come up with the first malaria vaccine against a parasite.
Yeah, so it was very, very dodgy.
Yeah, the malaria, the parasite is very dodgy.
Yeah. But when you invoke the use of word vaccine, the skeptics sometimes don't trust these vaccines. Why do you think there's a lot of skepticism from certain quarters?
So what I'd like to say is that before any vaccine is rolled out to the population, we do have rigorous steps that we have to go through. So you've heard about the research. We have the phase 1, phase 2, phase 3 trials, which look basically at safety of the vaccine. They look at the schedule and other parameters. So again, there are stringent rules and regulations that have to come out before any vaccine is rolled out to the population. Remember, vaccines are given to healthy people. So the healthy people are very averse to risk. So that's why any vaccine, before we roll it out, we have to follow those stringent measures, and we only use vaccines that have been approved by WHO within the country. And even after being approved by the WHO, it has to be registered by our National Regulatory Authority, that is PPB, and we continue monitoring the safety of those vaccines even when they're in wider use. So the vaccines are safe. Okay,
they're safe. Now look at China. Is it China or Japan? I think it's China. It was recently declared malaria-free, and I'm thinking, what would it take Kenya to attain, such status?
Yeah, so I know there has been a lot of efforts to ensure that we are a nation free of malaria. So we've had the interventions that I had earlier talked about, what the Ministry of Health has laid down. But the exciting news is that we recently have had WHO approve the wider use of malaria vaccine across sub-Saharan Africa, so which is going to be a game changer when it comes to us moving towards the elimination of malaria in the country.
Well, that's a good place to leave it. Thank you so much, Dr. Rose Jalango, for honoring our invitation.
Asante
that's
sana.
Rose Jalango from the Ministry of Health. We're going to take a short break. When we come back, we'll look at the day's business.